NBC, you know you messed up when a whole professional medical society has to release a statement on the misinformation in your news story, complete with the receipts of the data from the randomized controlled trials you chose to ignore. I'm a board-certified radiation oncologist, and in case you missed it, NBC released a news story stating that women are being shut out of intraoperative radiation therapy, or IORT, for breast cancer due to insurance. And according to NBC, the insurance decisions are due to a conspiracy by radiation oncologists like me because our guidelines don't endorse it. And the fact that the American Society for Radiation Oncology guidelines don't endorse it has to be due to money, and not the fact that randomized controlled trials show a recurrence rate of 4 to 8 times higher with this technique. There are so many layers of misinformation in this news story, so let's go through them one by one. Misinformation number 1, women are being shut out of IORT because it's about the money. That is an interesting take when, as a radiation oncologist who waits until final pathology is back, I have counseled many women on omitting radiation altogether, based on 2 major randomized trials, by the way, for invasive breast cancer, as well as a prospective trial on DCIS. I know, so crazy that I would do 0 sessions of radiation because it's in line with a patient's tumor biology and her goals, when NBC says I'm out here trying to get my bag. But guess what? Sometimes a patient's findings on her lumpectomy specimen will show that she's extremely low risk. So low risk, in fact, that IORT was never needed. But you know who has been shut out of making that decision for omission? A patient who already received the IORT. Misinformation number 2. IORT is valued around the world. You put this in your title, NBC, and I get it. You don't trust the guidelines from the American Society for Radiation Oncology because your whole news piece is about how American Medicare compensation is less for IORT. Never mind that the panel of radiation oncologists who wrote the guidelines you're criticizing included experts from the United Kingdom, Italy, and Canada. So fine, let me pull up the European guidelines then. Oh, look, this guideline similarly admits that the chance of the tumor coming back to the breast after IORT is significantly greater than with whole breast irradiation. And okay, NBC, you say you got your viewpoint that no, it's not the data, it's the greed, after you interviewed a dozen breast surgeons. But did you look up their guidelines? So let's pull up the American Society for Breast Surgeons guidelines. Here is misinformation number 3. Breast surgeons typically recommend IORT? No. Again, these guidelines are cautioning that both the major randomized studies on this technology reported higher rates of local recurrence. I'm going to give the benefit of the doubt that you simply forgot to fact check this and that you didn't make the intentional choice to leave out the fact that their guidelines also recommend against this technique based on the data. And let me be clear, I believe what the patient you interviewed said. She said she got IORT and then had to get whole breast radiation afterward and was very tired and had terrible scar tissue after completing the combination of treatments. This is an awful situation the patient found herself in because, as the breast surgeon you interviewed said, the final pathology doesn't come back until a week after the surgery. The patient found out after she had stayed anesthetized for extra time to get that radiation in the OR that she had an involved lymph node the whole time and never was low risk enough to get any sort of partial breast irradiation. This isn't uncommon, by the way, and it happens to 1 in 5 people treated with IORT. So why did this patient get the worst of both worlds? Here's misinformation number 4. You implied that the toxicities a patient receives from the combined IORT and whole breast irradiation are from the whole breast irradiation.
And what you are ignoring, NBC, is that the combination of IORT and whole breast irradiation has more than double the risk of scarring as compared to whole breast irradiation alone.
Finally, NBC, you gave this all or nothing picture. Misinformation number 5 is that you implied it's either IORT or whole breast irradiation, which you say will expose the heart and the lungs to undue radiation dose. Really? You're saying that when we as radiation oncologists are using external beam radiation for partial breast radiation all the time, 5 treatments, partial breast, based on a trial that actually showed equivalent effectiveness compared to whole breast irradiation. You're saying that when tools like prone positioning for better heart and lung sparing was invented 30 years ago, and my institution, USC, has over 25 years of experience combining prone and partial breast irradiation. But What do I know? I'm just an apparently money-hungry radiation oncologist.